Listen only mode.
Hi, my name is Mike Lau, and I'm going to talk to you today about anxiety. I'm a clinician at Health Directions, and I'd like to spend some time talking to you about the clinical aspect of anxiety and stress today. Anxiety disorders are diagnosed when an individual has subjective feelings of anxiety. It's important to understand that these feelings are subjective. That the person actually feels heart palpitations, they actually feel the sweating of the palms, they actually feel nervous. Okay, so these are more than just what an observer might see. These are actually subjective feelings that the person is going through. Another important aspect of anxiety disorders is the presence of comorbidity. And what I mean by comorbidity is the presence of another disorder or 2 or 3 or 4 more disorders along with the anxiety disorders. Probably the most common disorder along with anxiety disorders is a depressive disorder or substance abuse. Oftentimes, when we talk about anxiety disorders, we're also talking about depressive symptoms, such as hopelessness, helplessness, worthlessness, guilt feelings, sometimes difficulty in sleeping. That can be an increase in a person's sleeping pattern, a decrease in the number of hours of sleep they get per night, a change in their eating patterns, an increase in their eating or a decrease in their eating. Some of the different categories of anxiety. This includes things like phobias, panic disorders, generalizing to anxiety disorders, obsessive compulsive disorder, and post-traumatic stress disorder. When we talk about phobias, we're talking about a very disrupting fear for an individual. Typically, the individual is motivated by avoidance that's pretty out of proportion to the danger that's posed by that particular object or situation. The individual recognizes that that fear, that phobia is groundless. It's hard for them to understand why they're afraid of what they're afraid of or why they're fearing what they're fearing. That individual often suffer very intense stress, and that stress and that phobia, that fear, will often interfere with their functioning, day-to-day functioning, interfere with their work functioning, their school functioning, functioning at home, functioning with friends. Panic disorders. Panic disorders involve a sudden, often unexplainable attack of a number of different symptoms. Some of these symptoms can include labored breathing, heart palpitations. The person may feel nauseous. They may feel chest pain, like they're having a heart attack, or somebody's sitting or stomping on their chest. The individual may feel or have feelings of feeling choking or smothering. They may feel dizzy. The person may sweat. They may tremble. There's typically very intense apprehension or terror or impending doom. Panic disorders will often occur very frequently. They won't last for a very long period of time. Usually what we see are panic disorders that will only last a few minutes. The individual will often worry about future attacks, which is actually part of that panic disorder, part of that fear, part of that apprehension. And very rarely, but sometimes they will be linked with a specific situation. The key to panic disorders is that typically the person will not know when they're going to happen. There's not oftentimes a very specific situation that we can link them to, but sometimes there is. Probably the most common type of anxiety disorder is a generalized anxiety disorder, or what clinicians will call a GAD. Generalized anxiety disorder includes individuals who are just persistently anxious. They're just anxious all the time, more days than not, more days out of the week than not. They worry about things, the individual worry about things that are just out of their control. Typically they worry about everything in their daily life. Concentration is often very, very difficult for the individual. They find themselves tiring very easily, very little motivation. They often find themselves very restless, very irritable, very short-tempered. Oftentimes we see a very high level of muscle tension, which accompanies many, many different types of physical pains. Along with the generalized anxiety disorder, as I mentioned earlier, very, very high levels of comorbidity. Again, things like depression, substance abuse is very common with somebody who's suffering from a generalized anxiety disorder. We often see individuals try to self-medicate themselves. Sometimes they feel it's a lot easier to go out and drink a beer or two, or drink some hard alcohol, or take over-the-counter medication to a toxic level, as opposed to going to see a physician to take care of some of the difficulties that they're having with anxiety. Thing that happens is that it's a temporary relief. It's kind of a Band-Aid, and it's not going to solve a long-term problem. It's not going to take away that long-term stress and anxiety that's impinging upon their behavior and their daily functioning. Another type of anxiety disorder is obsessive compulsive disorder. With this type of disorder, we find individuals who are suffering from persistent, uncontrollable thoughts. They're compelled to repeat certain acts over and over, which often causes very significant distress and, again, interference with their everyday functioning. And that functioning can be at school, it can be in their home environment, it could be in their work environment. But oftentimes we see that functioning and that distress kind of bleed out all over. When we talk about obsessions, we talk about intrusive or recurring thoughts. So one way we can think about obsessions is that obsessions are thoughts, compulsions are behaviors. Okay, and compulsions are repetitive behaviors that we want to try to eliminate. Post-traumatic stress disorder is another type of anxiety disorder that's very common. Post-traumatic stress disorder involves extreme response to a very, very severe stressor. An increased level of anxiety is common. Oftentimes we'll see individuals try to avoid whatever stimuli was associated with that trauma. For example, if individuals who return from a war scene, if they were in Iraq, for example, military personnel often will avoid 4th of July celebrations because they associate the fireworks with bombs that have gone off. So they'll try to avoid that type of stimuli that was associated with past trauma. Numbing of emotional responses. Individuals who are suffering from PTSD or post-traumatic stress disorder will often numb any kind of emotional responses that are given to them. They kind of stop feeling anything. Along with post-traumatic stress disorder, that traumatic event that the individual has directly experienced or witnessed, this has to involve an actual threat of death or a serious injury, or a threat to the physical integrity of that person or to somebody else. So post-traumatic stress disorder is not something that is just thought up in the individual's everyday thinking or their everyday motivation. It's something that they've actually experienced that they're carrying with them, such as war, such as a shooting in a school. Oftentimes, people that go through that type of experience are going to suffer from the effects of a post-traumatic stress disorder. One of the other symptoms that we look for with post-traumatic stress disorder is the threat has to create a sense of helplessness for the person. They just feel that they have nowhere to turn, that there's no kind of outlet, that they're not going to feel any kind of relief from the symptoms that they're experiencing. Finally, with treatment of anxiety, typically with the anxiety disorders, again, what we don't want to see people do is we don't want to see them try to self-medicate. The self-medication, again, can lead to a lot of different kind of comorbidity types of disorders. It can often lead to the depression. It can lead to substance abuse disorders. What we try to do is we try to help that individual understand that seeing a physician and the use of psychopharmacology, the anti-anxiety medication, sometimes the antidepressant medications can be very, very helpful. Along with the psychopharmacology medications, we often will implement a certain type of therapy called cognitive behavioral therapy in combination with relaxation and kind of a mind-changing intervention. Oftentimes, individuals who are suffering from anxiety are their thinking is what we call irrational, and we try to change that into more of a rational type of thinking. Coupled with the anti-anxiety medication or the antidepressant medication, it kind of works as a band-aid, and it helps them kind of get to an even keel, along with the cognitive behavioral therapy and the cognitive relaxation intervention. We try to help them understand that at some point they can change their own thinking about how they're approaching the different symptoms of anxiety, and they're not going to have to be on that medication, that anti-anxiety medication or that antidepressant medication forever. At some point they'll be able to implement their own types of relaxation techniques, change their own way of thinking about things, and kind of wean themselves off that medication. That's about all I'd like to say about anxiety. Thank you for joining us. For more information about anxiety or depression or substance abuse, you can schedule an appointment by calling us at 1-800-288-5912. If you have any questions about today's webinar, you can send an email at communications@ncbhs.org. We also have many, many more webinars available online, and you can see those webinars 24 hours a day at www.healthdirectionsonline.org. We're very social, so check us out at any of the various social medias through Facebook, Twitter, YouTube. Again, thank you for joining us.